How you doing? My name is Dr. Calliope, and I'm going to be performing your comprehensive physical examination today. How you doing today? Well, I hope by the time you leave my office, you feel even just the littlest bit better. You mind if we just jump right in? Excellent. A go-getter. I like it. So, let's see what's up first. So, let me just check allergies, current medications, family medical history. Okay, so we have the whole kit and caboodle for you. Just see. Yeah, that looks great. Okay, so let me grab my otoscope. We're going to start by looking at your ears. So I'm going to flip on the light. We're going to take a look at the outside of your ears, behind the ears, and then we'll look inside, if you don't mind. Okay, so let's just go ahead. Here we go. My otoscope has been acting up a little bit. So I'm just going to take a peek at the pinna, which is that cartilaginous structure on the outside of the ear canal, right in here. Good, and then I'm just going to look behind the ear. Okay, good. This is a good spot to check, because you can't normally see it, but I can check to see if there are any skin abnormalities, for example. Let's take a little peek over here. Okay, so just checking on the contours of the ears and looking at the skin. The color is correct. The structure. Just look behind the ear with my light here. Okay. Alright, that looks pretty good. So I'm going to have a peek inside your ears. Now, I am going to keep my finger propped up against your head so that if you do turn or if you move at all, it's not going to jab you, okay? But I do ask that you just stay as still as possible, okay? Alright, let's go ahead and take a look here. So we're going to... There we go. Okay. Have you had any issues with hearing loss or any issues with sensations of the ear? Any pain, discomfort? Okay. And have you seen an audiologist or gotten your hearing tested within the last couple of years? Okay. Well, we'll do something just a little today. And maybe in the future we can talk about doing one of those full audiological examinations, okay? Alright, let me go ahead and take a look at the other ear. And there we are. So our inner structures look pretty good. Our ear canal looks good. Our tympanic membranes let's just take this off for now. Okay. So, little hearing test. Nothing formal, just to check. I have a few objects here. Let me just grab them. And I'll have you tell me whether you hear a sound on the left or on the right. So let me just grab a couple here. So just tell me if you hear something on the left or on the right. Good. Good. Mm-hmm. Good. 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 Mm-hmm. Both sides. Excellent. Now our second set of objects here. Left or right? Good. Good. Left or right? Right, good. 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 And right. Excellent. Okay. All right. Left or right? Mm-hmm. Good. 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 Mm-hmm. Both sides. Excellent. So, left versus right hearing is all good. So, let's take a look at your eyes. So, I'm going to get up real close. We're going to look at your eyes here. And there's a few things I'm looking for that I could spot right away that you don't have. We're looking at the sclerae and their coloring. We're looking at the lacrimal glands, their moisture levels, as well as their coloring. We have the eyelids and the conjunctival tissue there. We have the irises, pupils. We have the eyebrows, eyelashes, and that all looks great. So let me grab a little flashlight and have you look right here for me, okay? Alright, just look right there. We're going to check your pupillary response. Good, just keep looking right at my nose. Good. Keep looking at my nose. Alright. Very good. When's the last time you had one of these examinations? Okay, yeah, it has been a while then. Good. Well, I'm glad that you stopped in, that you made this appointment. It's very important to keep on top of our health when it's possible, when it's accessible, right? Okay, just keep looking at my nose, almost done. And right there. Okay. Would you mind just following this light, using only your eyes without moving your head? Okay, we are gonna do a little bit of eye tracking here. And usually we have a little bit of a more formal procedure, protocol. But this is just a little bit more visually interesting, is it not? I can still check your accommodation reflex from going in and out here. I can see your eyes move in the cardinal directions of gaze. Good, just keep following the light. That's great. I know it's a little erratic, a little chaotic. That's the fun of it, isn't it? Have you been surviving well in the heat? I know, it's just brutal, isn't it? Especially here where we have the issue, the phenomenon of corn sweat, which makes our humidity much higher than, say, Florida, for example. Most of our humidity is attributed to the corn. Okay, go ahead and rest your eyes there. And we're going to take a look at your nose, at your mouth, at your throat. And we'll also check on a few cranial nerves as well. We're just going to pepper those in as we go along. So let me grab the light and my tongue depressor here. Okay. Would you mind just tipping your head back so that I could get a clear view inside of the nasal passages, please? Thank you. So we're just going to take a little look inside of the nose here. Good. Okay, so looks like we're not very irritated here. Have you been dealing with seasonal allergies lately? Oh gosh, I've had the absolute unit of hay fever this year. It's been just awful. I can't remember a time it was so bad. And you can go ahead and right your head. And would you mind just sticking out your tongue? Good. And if you could move it to one side here and the other. Up, down. Good. Can you lift your tongue to the roof of your mouth? Just want to check on. Okay, good. Now you can put your tongue back down. And I'd like to have a look at your teeth and your throat here. Just look at the teeth. Are you fairly regular on dental visits? Yes, as an adult, it's been a godsend that a lot more dentists cater to more anxious patients. Teeth can be very, very painful. And I remember as a kid, dentists were not very cordial. But it's different these days, so I'm glad for that. Would you mind just sticking your tongue out as far as it can go? And I'm going to push your tongue down. Okay. So right about there. And then we'll take a peek at the pharyngeal wall. Yes, it's too bad because people know that the mouth and the teeth are extremely painful. We have a lot of nerve endings there. It would do well to be sympathetic to that, but a lot of people cater to that nowadays, so much better. Okay, would you mind saying ah for me? Okay, uvula looks good. Alright, and just as a little bonus test for our vagus nerve, I would like you to just do a dry swallow for me. Okay, just take a dry swallow. Just like that. You can take a moment, yeah. Okay, great. And I'm actually going to have you take a second to regroup, but if you could do that again, I'm going to check on your thyroid while we're here. Okay, and when you're ready, if you could just do that dry swallow. And there we go. Okay, good. I won't make you do that a third time. It's hard enough the first time, let alone the second. So, I have a few neurological questions for you. We are going to be testing memory, your ability to follow commands, your orientation, things of that sort. So, firstly, would you mind telling me the time that your appointment was? Excellent. And where are we? You can say the building name, the street name, just something fairly close. Okay. All right. And who are you? Okay, good. Orientation to person. Good. And what are we doing today? Comprehensive. Physical exam. Exactly. So, I am going to say a list of a few words. I'm going to have you repeat those words back to me, okay? Apple, bubble, carpet, dusk, eagle. Apple, bubble, carpet, dusk, eagle. Apple, bubble, carpet, dusk, eagle. What is that list of 5 words? Excellent. Now, I am going to have you follow some very simple commands, and these are going to involve differentiating between left and right. So if I could have you first close your right eye and put your left hand on your head. Close your right eye and put your left hand on your head. Just like that. Good. If I could have you cross your left arm over your right shoulder and turn your head to the right. Cross your left arm over your right shoulder. Turn your head to the right. Good. Just like that. Excellent. And if you could lift your right leg and pat your left leg with your right hand. Lift your right leg, pat your left leg with your right hand. Lift the right leg and pat Just like that. Very good. Now I am going to read a very short story. It's only going to be a few sentences long. I'm going to have you try to repeat the story as best as you can, trying to use the exact same wording. Okay? I'll read it a few times, and then you can give it a shot. On Saturday, August 10th, a 3-car pileup blocked Highway 16 until 8 p.m. 1 car was totaled, 1 car was damaged, and 1 was fine. No injuries occurred. On Saturday, August 10th, a 3-car pileup blocked Highway 16 until 8 p.m. 1 car was totaled, 1 car was damaged, and 1 was fine. No injuries occurred. Need one more time? Okay. On Saturday, August 10th, a 3-car pileup blocked Highway 16 until 8 p.m. 1 car was totaled, 1 car was damaged, and 1 was fine. No injuries occurred. Would you mind just trying to repeat that as best as you can, trying to get the exact wording? Excellent. Now, I had you repeat a list of 5 items a few minutes ago. Do you remember what that list was? Apple, bubble, carpet, dusk, eagle. Very good. Let's go ahead and bring out the stethoscope. We'll take a listen to your heart and lungs. Okay. So, we're going to start with your lungs. I am going to have you take a deep breath in for me. And out. Deep breath in. And out. Deep breath in. Deep breath in. Deep breath in. Good. Deep breath in. Last row. Deep breath in. And out. Deep breath in. Let me take a listen to your heart. So we're going to listen with the diaphragm here to our aortic valve, our pulmonary valve, our pulmonic, our tricuspid, and our mitral. And then we'd want to do a little bit of palpation here. So I am going to feel along your chest. Along the valves, we're going to feel for heaves with the heel of the hand and for thrills with the flats of the fingers. So we're going to start with heaves, and I'm just going to have you breathe normally. You got any cool plans for the weekend or even through the week? Yeah. sometimes it's nice, especially with this heat, it's just nice to hang out a bit. And we're going to check for thrills. These are palpable heart murmurs I can feel with the flats of my fingers across the valves. Okay, good. We're going to try to do a little bit of maybe some hiking while it's not too hot. And then probably just do house stuff until the heat breaks. Okay, so let's go ahead and do a little bit of percussion here. So percussion involves me placing my hand on your chest, and then I'm going to use one finger to tap on my knuckle here. And what I'm doing is I'm listening for the sound that it makes inside of the chest here. You can hear that sort of resonant tone, which is what it should sound like. So we can tell if there is fluid in an area, for example. It might be very dull or have a stony dullness. We might get hyperresonance. So I'm just going to tap along those same places that we did the auscultation. Okay? It's not going to hurt. Good. And we're just going to come along the chest here. In ye olden days, percussion was not nearly this gentle. And it was probably actually pretty painful. People really went at it. Okay, so let's go ahead and I know you had your blood pressure done when you came in. I want to check on it again just to see if there's any change. So we'll get this all set up. I'm going to need this bad boy in a second. So, do you mind if I use this arm? Okay, so I'm just going to feed your arm through the cuff here. And then we can run our tubing right along the radial artery here. I'm going to put the dial in on the cuff. And I'm just going to make sure real quick. So the bulb has a little release valve. So we want to make sure that is tightened up. And then let's place the diaphragm of the stethoscope right in the crook of the elbow here. And then I'm just going to have you relax your arm. Just let it go limp. Okay. Let's see what we got here. Okay. I'm going to slowly let some of this air out. Very slow. Okay, let it all go out. We'll give it a second to empty, and then we're going to go back in one more time. Okay? This is one of my least favorite parts of a physical exam, personally. The cuff just gets very tight, but we're very quick about it. Just let the air out, and there is the diastolic. Good. Okay. Alrighty. Good systolic and diastolic numbers here. hands and let's take the cuff off of you. Okay. And just carefully place that on our table. Now, I'm going to check your pulses. I'm going to let my little oxygen saturation meter count the actual beats, but I'm going to be measuring the quality of the pulses. So I have a little finger meter here. If I could have you just put your finger inside here. We'll clip that. So you hold on to that, and on the other side, I want to just check on our radial pulse, our ulnar pulse, and our brachial pulse. Okay. So we'll just sit here for a moment, and I don't need to count. I just need to measure what quality's like. Okay, ulnar pulse is good. How about brachial? Very good. Now, if I could see your other arm, just be careful with the meter. Radial's good. Ulnar's good. Brachial. That's good as well. Would you mind if I have that meter back? Okay. And we have a 68 beat per minute, and we had our millimeters of mercury for the blood pressure. Now, I'm going to be feeling some of your lymph nodes. I'm going to focus on your ears, your neck, and your clavicular area. Okay? So you'll just feel my fingers kind of rolling around, almost like a very light massage here. I'll go behind the ears, in front of the ears, under the jaw, down the neck. We're going to come a few places here. Okay, and supraclavicular here, above the clavicle. Okay, so I'm going to take a peek at your skin real quick, and then we'll do a couple more cranial nerve tests. So let me just grab my Tromner hammer here. And I have my little neurological tool. We'll come back to the hammer in a little bit. So, I'm going to take a peek at your skin, and actually I'm going to bring in a little bit of light here. Do you have any particular issues with your skin, or any moles that look odd, or anything new? Okay, good. And have you ever gotten a skin check from a dermatologist? Okay. Yeah, that's something we want to think about, especially if we've had a history of sunburn or being out in the sun a lot. Just better to be safe than sorry, especially when it comes to skin cancer, right? Yeah. Okay, now I want to just feel the texture of your skin. I'm going to do this with just the one hand, alright? Okay. And I'm just just feeling for any textural differences. Sometimes there are things that we can't see very well, but we can feel much better. Is any of this painful or tender at all? Okay. Just using a little swiping motion here. Make sure I got everything. Okay. Good. All right. So, I have my little tool here. We have a sharp side and we have a soft side. So this is our soft. This is our sharp. Okay? I'm just going to have you close your eyes and tell me whether you feel the soft or the sharp touch. Okay? All right. Soft. 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 Oops, all softs. We're just gonna keep going. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Okay, good. Just gonna pop that back in our little receptacle here. If the little bristles want to go in. Nope, they're being ornery. There we go. And then we will check on your facial nerve. It's cranial nerve 7. So I'm going to have you just copy some of my facial expressions. I'm going to have you give me a real big smile. Yep, showing your teeth. Good, and can you puff out your cheeks? Good, and raise your eyebrows. Close your eyes real tight. Okay, open them real wide. Very good. Okay, that's great. Now, let's bring out the stethoscope again. Our tool of the day. I'm going to be taking a little listen to your abdomen now. So, if I could have you just breathe normally here. Good. Just taking a listen to the organs, how they work in concert. Good. And we don't have too much left after this. Some balance and coordination, extremities, reflexes. And we're done with that for the day with you. And I am going to do some palpation on your abdomen. Would you mind letting me know if anything is tender or painful at all? Okay. Just feeling the quality here in the abdominal feel some specific organs. See if there's an issue with enlargement at all. Want to make sure nothing is painful, nothing's tender, that there isn't any guarding. Okay. So, let's bring out our Tromner hammer again. And we are going to check on some reflexes. Would you mind popping your foot up on my knee here? That way, I'm going to get your Achilles tendon, but I want to hold onto your foot so that I get a little bit of tension in the tendon right there, and then I can just tap on it. Okay? So, foot up here. Good. I'm going to hold your foot, and then I'm going to tap on the tendon. Okay? Alrighty. Okay. Good. And if I could have the other foot here, holding the foot. Good. There we go. Now if I could have you just let your legs hang off of the table. I want them to be nice and loose, as if they are wet towels, just hanging there. Okay. And we'll get the patellar reflex. Good. Good. 1, 2, 3, 6. Good. Patellar is always the easiest one to elicit. That one's a lot more fun than the other ones. You get a bigger jump, and it's easier for the patient to see the results as well. Now, if I could have you put your arms across your thighs, so that again, they are hanging like loose, limp, wet towels, just like that. And I'm going to get your triceps reflexes and your biceps reflexes. So, triceps is on the back of the elbow. Good. And biceps will be the crook of the elbow here. I'm going to put my thumb in the crook of your elbow and tap on it. Biceps reflex. Good. All right. Now let's take a look at cranial nerve 11 to finish off our cranial nerves. This is a really easy one. It's the accessory nerve. I'm just going to have you shrug your shoulders up and then down, up and down, just a few times. Good. Very easy. So let's take a look at your extremities. We got your pulses on the arms and hands, or wrists, I should say. I'm looking at the skin, checking the temperature, and I want to look at the nails real quick, just pinching them and then letting go. So we pinch until they blanch. You can see the color is a lot whiter on me. And then release and see how long it takes for the color to return, which yours came back very quickly. So that is indicative of good circulation. So I'm just going to squeeze on your hands a bit. See if the joints are tender at all. Let me know if they are. All good? Okay. Would you mind showing me your palms? Alright, they are of normal coloring. No palmar thickening. We don't have a contracture here. Good. Looks great. Nails look great. So let's move on to the legs here. Now I'm going to check the popliteal pulse. So this uses both hands underneath the knee here. There we go. That one was quick. Sometimes these are not very quick at all. Yep, that one's a little more difficult. Oh, there it is. There we go. And we will do post-hip by the ankle. We're just checking on quality here. And dorsalis pedis on the feet. Good. Good. Okay. Now we'll look at skin. We will check temperature. Yeah, looks good. Shins look great. Knees here. If I palpate around the knees, is that painful at all? No. Okay. Very good. So, lastly, we have a few balance and coordination tests. The very first thing I want to test for dysdocokinesia, which involves you flipping your hand back and forth as fast as you can. Which, if you do have dysdocokinesia, then you would not be able to do that. So, just flipping back and forth, back and forth, back and forth, just like that. So, can you put your hand on your other hand, flip it, and go back and forth? Good. And how about the other hand? Good. Okay. Now the nose finger test. I am going to put my finger right here. I'm going to have you touch your nose and then my finger. Just like this. Okay. Go ahead and touch your nose and then my finger. Nose, finger, nose, finger. Fast as you can. Now can you close your eyes? Touch your nose. Touch my finger. Nose, finger, nose, finger, nose, finger. Good. Okay. Open your eyes. And this time I'm going to move my finger around. So you will touch your nose and then my finger wherever it goes. Okay. Go ahead and nose, finger, nose, finger. Good. Good. And you can stop. Alright. So we have a little test standing up, and then we have a few tests walking. If I could have you stand up. Okay. I'm going to have you put your arms out in front of you, and I'm going to have you close your eyes. Okay. You're going to try to just stay in place. I'm going to bracket you in, so if you do lean to one side or another, I will catch you. Okay. Go ahead and just put your arms out. Close your eyes. And I've got you spotted here. And all you have to do is just stay still. And this tests your balance because your balance needs 2 out of 3 systems to work, and your vision is one of the systems. So if you do have an issue, then as soon as one of your systems is turned off, then we'll see it immediately. And you're not having any issues. So last test. I am going to have you walk normally to the end of the room over there, okay? Just normal speed. I'm going to watch your gait, and then I will instruct you to walk a few different ways, okay? So if I could just have you walk to the end of the room. Good. Can you walk on your toes coming back? Yep, on your tiptoes. Good. And can you walk on your heels to the other end of the room? Good. And can you walk one foot in front of the other, heel to toe? You can put your arms out if you need to balance. And that looks great. Okay, so gait looks good. Coordination looks good. So I'll have you sit down. Let me just take a peek at our exam, make sure we got everything. Oh, one test. I'm going to have you lay back on the table, okay? We're going to do one last coordination test. What I'm going to have you do is you're going to pick your heel up, and on your leg, you're going to put your heel on the opposite knee, go down the shin, pick it up, bring it back. So it'll look something like this. Okay? So just pick up your heel, put it on your opposite knee, slide it down the shin to the ankle, lift off and repeat. Good. This is the heel shin test. And if you could just swap to the other side. So pick up heel, put it on knee, slide down. Do that a few times. Good. Okay. Now that actually is the last test here. So, how you feeling? How do you think you did? You did just fine. You did great. So, we talked a bit about maybe an audiology appointment at some point. You just jot that down. Audiology. And we talked about a dermatological exam at some point, if that is accessible. So we can take a look, and I would really like to see that done here soon because you haven't done one of those. So if you'd like, we can look at the providers we usually refer out to and make sure they take your insurance, if that's okay with you. Okay, great. We want to be on top of that. So, do you have any questions at all? No? Okay. Well, you are all set for another year, and yeah, history looks great. I don't think we'll have to see you back any sooner than that. Okay? So, let me just sign off here. And that will conclude our examination. I'd like to thank you so much for coming in today, and you were a wonderful patient to work with. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you want to help support the channel and get perks like early access to videos, ad-free videos, Patreon exclusive content, and audio downloads of all my content, I have a link for my Patreon in the description below. Thank you so much for watching. I hope you have a whale of a day and a good rest of your night.